Hi class, it's Miss Moran again. Today I'm going to talk to you about Chapter 10 from your step-by-step book. Chapter 10 deals with modifiers. Keep in mind that modifiers are not used very often, but you do need to know about them. So CPT modifiers are used to describe alterations to a code. There's a full list in Appendix A in the back of your CPT. Modifier functions as for example, a procedure was altered, more or less was done. The procedure was instead of on one side of the body, it was on both sides, called bilateral, or multiple procedures were done, or only a portion of a service was done, or more than one surgeon assisted in a surgery. Also, there's a modifier for unusual. Uh, Modifier 22 is increased procedural service, indicates services were significantly greater than usual. It's got to be accompanied by a report, and it will describe the increased work. Let me go back and see. I can't go back, but an example of 22 modifier would be a tracheostomy on a patient with a short, fat neck, making the procedure more difficult. Modifier 23, unusual anesthesia. This is usually the anesthesia, whether it's local or not, would be the norm. Where no anesthesia would be the norm, excuse me. So sometimes we have to say it's a kid that needs to get a little suture and a quick one or an injection or something that, and kid's just crying his head off and the procedure cannot be done. Well, they may give him a little bit of anesthesia. An example, a highly agitated senile patient. This modifier 23 is only used with anesthesia codes, and a written report might help out to explain why that modifier was used. Now we move on to unrelated E&M. Remember, E&M is evaluation and management, and those are our office visits and hospital visits, etc. So modifier 24 is used with E&M codes only. Here we go. And this 24 is used during a post-operative period. So, for example, when a patient comes to the office and is in a post-operative period, remember 90 days for major surgery, 10 days for minor surgery, and say the patient comes in and to see the doctor for something totally not related to the surgery, the doctor needs to bill for his services for that office visit. So what you're going to do is you're going to attach that 24 modifier to your evaluation and management code. Okay, only use 24 on evaluation and management codes. Modifier 25, separate identifiable E&M service. Again, you see E&M service. So that's only going to be used on E&M codes by the same physician and the same day of a procedure or other service. So let's take a look at what an example would be right over here. Patient seen for sinus congestion, and the provider performs a history and physical and prescribes a decongestant, and then he notes a lesion on the back and he removes it. So the lesion on the back has nothing to do with the sinus. So you would code the E&M code with the 25 modifier, and then you would code for the removal of the lesion as well. 26 modifiers for professional component. That means professional, they mean the physician. That's 26, and the technical component is TC. Example, a radiologist reviews an x-ray. That's a 26 modifier taken by the technician. TC is the technical component. Mandated services, this is a request by an insurance company or maybe workers' compensation. Maybe somebody had an accident at work and the workers' comp wants to verify some information or see what situation the patient is in. So request that the patient be seen by a physician. It could also be a court mandated service. So that 32 modifier, again, is mandated services. It's not a request from a patient or the patient's family or even another physician. It's not, it's going to be from a payer, an insurance company, from workers' comp, or from an official body. 33, preventive services. Patient Protection and Affordable Care Act of 2010 requires coverage without cost. United States Preventive Services Task Force grades preventive services, grade A, substantial, B, and that's it for preventive services. So modifier 47, assistance by surgeon. Most of the time it's the anesthesiologist who administers the anesthesia and the surgeon does the surgery. But sometimes it's not always like that. With 47, the physician is the surgeon and also the anesthesiologist. So that 47 modifier is used only with surgery codes. So no separate for Medicare patients. Bilateral procedure, 50. Example, procedure on the hands, on both hands. And you need to stop for a second whenever you're looking at codes, and because some of them may say that some codes describe the bilateral procedures. In these cases, do not apply the modifier. 50. Multiple procedures, 3 types, whether it's the same procedure that's done in different sites, like a repair of multiple lacerations. Maybe it's multiple operations, same operative session, like maybe repair of several fractures during the same operation. Procedures performed multiple times, like a trigger point injection, for example. 51, multiple procedure. You list the most resource intense first, which is the highest RVU value, and then all the following codes are going to have the 51 modifier. Remember, you cannot use 51 modifier on add-on codes, and also there are codes that may be 51 exempt, so you have to keep your eye open for that. So usually the first procedure is paid at 100% of the allowable, and the second at 50, and the third at 25. Medicare is going to pay the first procedure at 100%, the second through the fifth at 50. Reduced services, this is going to be, the reduction is going to be the physician that directs that reduction to stop the service that's being performed. And there's a documentation that has to be provided to explain why there was a reduced service, like what happened. We cannot use reduced services for a patient that's unable to pay a fee. We submit the full charge and the payer is going to adjust dollar amount. An example, a lip shave, but advancement flap was not performed. So you put your code and your 52 modifier. 53, discontinued procedure. It could be surgical, it could be a diagnostic procedure. It's started and then stopped due to the patient's condition. This does not apply to pre-surgical continuance. Do not use 53 when the patient cancels a scheduled procedure. And do not use it with E&M codes. Do not use it with time-based codes. 54, surgical care only. The surgical care only is called intraoperative. So that's used if the physician only does the operation. The transfer of the patient has to be documented in the record. So the doctor does the surgery and he's not going to be doing the postoperative care. He's going to be sending that patient to someone else for the postoperative care. Some payers require transfer. The postoperative management only, the physician provides care only after the hospital discharge. If the patient is transferred while hospitalized, report post-op management with subsequent hospital codes, hospital care codes. The documentation, everything has to be documented in this business. So the surgery code would be billed with modifier 55 and the date of the service as well. We bill the 55 after the first post-operative visit. 56, preoperative management only. And it says clearly that the physician provides only the preoperative service. That would be like, I don't know if you've had surgery or not, but before major surgery, a patient has to have a chest x-ray, some blood work done, a PT, and then also an EKG. So most surgeons don't provide that service. They usually will send the patient to their primary care physician to do that, and that would be 56 modifier. Unusual reimbursement for portions of a surgical package. So that's again, if we're talking about the preoperative, intraoperative, and postoperative care. Preoperative care is 10% of, say, the allowable is, I don't know, say $1,000. So 10% of the $1,000 would be allocated for the preoperative, 70% for intraoperative, and 20% for postoperative. Each payer is going to determine the portions. Decision for service is used with evaluation and management codes only, okay? With the medicine section as well. So, decision for surgery, for example, would be, say that someone went to the doctor with a very bad sore throat, and the doctor examines the patient and says, you know, you have a really bad tonsillitis. We need to do a tonsillectomy, and I have time to do it this afternoon. So would you like to get it done? And the patient says, yeah. So that's within a 24-hour period. So you would bill the office visit with the 57 modifier, and then the tonsillectomy with whatever the code is for tonsillectomy. A staged procedure is usually done by the same physician or other qualified healthcare professional during a post-op period. And this is planned from the first procedure of the surgery, or first part of the surgery. It's planned ahead of time. So that's what makes it a staged procedure. Subsequent procedure is planned or related to the first surgery. During the post-op or previous surgery in series. Example, multiple skin grafts are completed in several sessions. Each time a session is completed, the global period is going to start over again. Those 90 days will start over again. Do not use 58 modifier when the code describes a session. For example, lesion destruction of retina, one or more sessions. So when you see that one or more session, I'm sorry, here or there, let's erase that. Where you don't use the 58 modifier. Distinct procedural service. Modifier 59 is used for a different session or encounter or different procedure or different site, or a separate incision, excision, lesion, or injury. Do not use when another HCPCS modifier is appropriate. An example, physician removes several lesions from the patient's leg and also notes a biopsy of a mole on the torso. So you can see that the code for the biopsy of the mole would be 59. So first you will code for all of these lesions that were removed, and then you're going to code for the biopsy because it is a separate procedure. You'll put modifier 59. There are some Centers for Medicare and Medicaid Services have identified 4 HCPCS subset modifiers that are referred to as ex-EPSU modifiers. And we could go over those at some other time. Those are going to be in your HCPCS book. 2 surgeons, both are functioning as co-surgeons, as equal in a procedure. They're usually of different specialties, and each surgery is going to report their code with a 62 modifier. Each surgeon dictates a portion of the procedure. 63 procedure performed on infants less than 4 kilos. That is 8.8 pounds. The reason is that small sizes increase complexity. So 63 is used specifically with infants less than 4 kilograms. Okay. You can use that 63 with all sections, all surgery section codes except the integumentary, and those are exempt, and you'll see notes in there. 66 surgical team, 3 or more physicians, various specialties, plus technicians and other support personnel. This is for very complex procedures. The payers may payment. Repeat procedure or service, same physician, 76 modifier, same physician or other qualified healthcare professional. So this is used to tell the insurance company, hey, you know what, this is not a typo error that I made when I was preparing my claim form. It's not a typographical error. It's used to indicate that the procedure had to be repeated. Example of an x-ray before and after a fracture repair. Aerosol treatment for asthma attack repeated in 90 minutes. You can see how the code presents. 77, repeat procedure, service or by another physician or other qualified health care provision. Note another, okay, not another or other. Performed by one individual, repeated by another. So it's important to understand that. Performed by one individual, repeated by another. They're going to want to report. Most of the time when we use a modifier, the insurance company is going to want to report. 78, unplanned return to operating room. Same physician following the initial procedure for a related procedure during post-op period. And this is going to be the reason for the return is going to be a complication of the first procedure. Like a patient has an outpatient procedure in the morning, was returned to an operating room in the afternoon with severe hemorrhage. In the case that this is not a typo, it does not change the global period. 79, unrelated procedure is serviced by same physician during the post-operative period. Several days after discharge for a procedure, the patient returns for an unrelated procedure service. The diagnosis, of course, would be different. Remember, E&M code, your E&M code would have to have your 24 modifier. Distinct, okay? If the surgery is unrelated to the original procedure, a new global period. Assistant and minimum assistant surgeons, 80 for assistant. They are reimbursed at 15 to 30% of the allowable. And 81 is minimum assistant surgeon. Services at a level less than described in 80. and the reimbursement is 10%, if anything at all. Assistant surgeon is used most of the time. Teaching hospitals will have a resident assist as part of the education. So if that's a resident there, just will be no fee and no modifier 82. So try to remember that if you're coding for a hospital that uses residents, a teaching hospital, and they assist in a surgery, you cannot bill for them. 90, reference outside lab. Physician has a business relationship with the lab. The physician pays the lab and then bills the insurance company for the service. 91, repeat same laboratory test on the same day for multiple test results. This a 91 modifier is not used to rerun or to confirm original test results. Okay, it's not to be used if there is a malfunction of the equipment or messed up. 92, alternative laboratory platform testing indicates a kit or transportable instrument, usually a single dose disposable. An example is HIV test kit. I guess now it's coronavirus test kit. 95, synchronous telemedicine services. It's used when the physician and patient interact from separate locations. You'll see a star symbol there in your book for that, and the complete list of the codes that can be used with 95 is in Appendix B. Appendix P. 96 and 97. So these are for habilitative services and rehab services. So habilitative services is helping a patient learn skills for daily living that have not yet developed. And 97 is to help regain skills of daily living functions that have been lost or impaired due to an illness or injury. 99 modifiers. So when we have a service that needs more than one modifier, but the payer only allows for one modifier with each code, we put 99. And then there's another area where we can explain that. You can see here, you would put, say, your individual modifiers. If your insurance company says this particular code right here can only have one modifier, then you would, above this area on the claim form, there you can explain what those modifiers are. And that's the conclusion for Chapter 10. Thank you, and contact me if you have any questions. Be safe out there.